And good afternoon and welcome, welcome, welcome. It's our regular Lunch and Learn. And today we're going to be talking about politics and medicine. And if you are paying attention at all, you know that we've had quite a lot of political intervention with our health care. And I did not know until I was reading this article. I was reading it. It came out in March, but I just got around to it this week. And it is an interview with a man named Mr. Gaskins. Hang on a second. His name, doesn't give me his first name. He wrote a book called In the Name of the Pill. All right. And it was all about birth control and that kind of thing. This is an interview with him about this because he has upgraded or updated his research. And so I did not understand a lot of this. And of course, I know about birth control. I was on birth control in my younger, more fertile years, and it was deemed safe. People thought it was safe. Your doctor told you it was safe. However, I did not know that in the 1970s, in fact, 1970, there was a Wisconsin senator called Gaylord Nelson. He came to Congress and he wanted to have some information on the pill and was it safe for women? Now, the pill first became legal for women, okay, in the 1960s. So 1970, they had 10 years of data. So during this congressional hearing, they brought to national attention the risks of birth control pills. Drug companies were forced to include the first ever patient information pack in the drug. This new formulations were developed, the drug makers claimed were safer. In the end, the drug companies managed to make their pamphlet virtually unreadable for the average layperson, and there was no real science to prove the new formulations were any safer. But the appearance that they were complying and looking for safer solutions probably helped them deflect ongoing scrutiny. So in the 1970s, they knew that the pill caused problems. Now, here in the clinic, we have dealt with infertility. The pill causes you to be infertile long term. Now, we all know that the purpose of the birth control pill is to what? Prevent an unwanted pregnancy. However, people do not know that when they take birth control pills, they may be absolutely sterilizing themselves chemically, which is what's one of the side effects were that nobody talked about. Now, today in our clinic, we see a lot of people that are infertile. And as far as I know, we've been pretty successful in helping reverse that trend. But we actually had one lady come in, it's been a few years back, and she had come in and she was on some hormone replacement, and she was having all kinds of acne and breast tenderness and different things. And she came in and she wanted us to balance her hormones. And so we were able to do that with herbs and supplements. She called it about within 6 months. I don't know exactly what the time frame was. It wasn't right away, but when we had checked on her, she said that things were better. The breast tenderness had gone away. The acne had gone away. And she called us later within 6 months and said, I'm pregnant. And, when someone calls you on the phone and says, I'm pregnant, you don't really know if this is a yippee or an oh no. It's just one of those things. And I had no context clues. And I said, okay. And she said, no, you don't understand. And it's like, okay. She said, I have been trying for years to get pregnant. I went to multiple infertility specialists. They told me that I would never have a child because I had been chemically castrated. That was the medical term, chemically castrated by the birth control pill. She said, and I am pregnant. It was like, well, okay, yippee. This is a good thing. As a young woman myself, I come from very fertile stock. I did not want to have a whole lot of children. It was just, I didn't think I could handle them. I didn't think my personality, there were a lot of reasons. And so I was really happy that there was birth control because I did not want an unplanned pregnancy. At the same time, had I known that they knew that there was all of these complications, I probably would have made a different choice. And so this is something that in the history of this back in the day, there was this political. The population is too big. We're not going to have enough food. We're going to run out of land. We're going to run out of resources. And I remember as a child in grade school, I remember those conversations, and it was like, I don't want the population to be overgrown. I don't want to run out of food and all those kind of things. And that was the political narrative of the day. And so the birth control pill fit into that narrative of we're going to be responsible, we're going to protect the planet, we're going to not have unwanted pregnancies, et cetera, et cetera, et cetera. Okay. So one of the first things that they found, and this was in the 1970s, one of the first things they found that women who were on birth control pills, when they would give blood, when you give blood, your blood is separated into red blood cells and plasma. Okay. So if you were on birth control pills, they found that your plasma was green. Plasma is not supposed to be green. Plasma is supposed to be straw colored. Okay. The labs rejected the plasma. They sent it back, but they couldn't shake their curiosity about why the plasma was green. And so they did their research going all the way back to the 1960s. The doctors at that time started seeing started seeing green plasma coming from the young donors, and they determined that it was caused by the pill, birth control pill. Their studies identified the source of the green color as an overabundance of the copper-carrying protein. I'm going to mess this up. Ceruplasmin. Okay, Ceruplasmin. They learned that the green plasma had a much higher propensity for clotting, but all of these studies mysteriously ended in 1969. The doctors could not find any literature from subsequent decades. The Red Cross came out about that time and decided that if it looked green, you shouldn't use the plasma. They made a policy decision to only take plasma from men because why? Men don't do birth control. And so that kind of eliminated the problem. But the problem is that the women are still making plasma, of course, because that's what your bone marrow does. It replenishes your blood supply, and we like that and we want that. But if we're on birth control pills and it's making too much of this copper protein, then we are setting ourselves up for blood clots. Now, I remember in the literature said by the time you are 35 years old, you need to get off the pill because there is a high incidence of blood clots. And that's even worse if you are a smoker. Now, I'm not a smoker. I've never been a smoker. But when I turned 35, I got off the pill. Why? Because I did not want to have a blood clot. What we did not know, and they did not tell us, is that taking long-term birth control pills actually sets you up for long-term infertility and sets you up for autoimmune disease, right? They didn't tell us that, but they knew that. So a lot of clinicians have never seen green plasma because they quit taking plasma from young women that were on birth control pills. He goes on to say that women or people receiving blood transfusions from women often develop clotting issues known as transfusion-related acute lung injury. This became such a concern in the United Kingdom and the United States that they moved to all male plasma donors. Now, they knew this. They didn't tell us this. They just changed their policy to only have male donors, okay? The writer of the book goes on to say, often a young mother will weigh the pros and cons of taking hormonal birth control if she's breastfeeding. It's only natural she would worry about how these drugs would affect her baby. If she does a web search, many of the top hits will assure her that it is completely safe for the baby. And this is how it works with our Google reviews, right? However, if you drill down, the studies show that infants who are breastfed both males and females who are breastfed from mothers who are taking birth control pills, they start developing breasts as infants because of the extra hormones that come through the blood. They say that when the mother quits nursing the child, then the excess hormones are excreted by the infant, and so there's no long-term damage. However, the author goes on to say that we are now looking at 40-year-olds, and we are finding that there is a propensity for autoimmune disease. Okay, so this is really important, very, very important information. So in 2009, okay, Bayer, the company, pharmaceutical company Bayer, had run ads retracting earlier promises that its birth control pill Yaz would clear up acne and reduce PMS. I remember them telling me that when I was a young woman, all right? Birth control pills are prescribed for acne, for PMS, for endometriosis, and for PCOS. PCOS is polycystic ovary disease. And this researcher says that there is absolutely no scientific evidence that says birth control pills helps any of these conditions, okay? The author goes on to say that there are several examples of off-label prescription that are very, very common. When a girl first starts her cycles, she'll be prescribed birth control pills to regulate the cycle. He says her periods may be heavy or unpredictable because she has not yet matured. Doctors use this as an opportunity to regulate her period with birth control pills. When the women get older and approach perimenopause, the pill again is recommended to regulate periods, despite them being at an age where the risks are even more pronounced. The irony of birth control is that it does not regulate periods in either case because it actually shuts down the cycle. The monthly bleeding isn't even a period, it is pill withdrawal. Okay. Many doctors also lead their patients to believe that hormonal birth control is a treatment for PCOS. There's nothing therapeutic about it. It may even elevate some of the pain or relieve some symptoms, but it does nothing to treat the underlying issue. Now, we don't know that because we're not the scientists, and so we have to believe what our doctor tells us to, okay? So we've got to do our research. We've got to understand that the overprescription of steroids and birth control starting in very young women has created an epidemic of infertility. Now, I had thought that the epidemic of infertility, and I agree that there is that because we're seeing that all the time. When I was young and fertile, nobody had trouble conceiving. They just didn't. And so this is a problem that is probably in the last 20 years, we've seen this. I put it down to the food supply with all the genetically modified organisms that are in our food. It has been shown that these GMOs wreck your digestional tract. And it has also been shown, I think they've shown it in rats, that it shrivels up the ovaries. And so I attributed the infertility to the addition of the GMOs in the food. But he says, this doctor, this researcher says, that the women who are taking the pill, they are suppressing their ovulation cycle with the pill, and they will suppress it so far that they suppress it permanently, which is exactly what we're saying. He says, I've had many women tell me that they took the pill for 10 to 20 years, only to find out afterwards it was unnecessary because they were infertile. They were stunned when I told them that the birth control may have actually contributed to their infertility. It is a phenomenon called oversuppression syndrome. By shutting down the body's natural production of hormones for so long, the system essentially atrophies, leaving women infertile. So this is the deal with the ovaries. If they atrophy, they shrivel up. And we see that with the genetically modified foods. I did not know until I read this article that it was also contributed to by the steroids and birth control pills. I did not know the steroids had birth control pills had steroids. I thought the birth control pills had estrogen. People were worried about the synthetic estrogen causing cardiovascular events, et cetera, et cetera. All of the news that we, the lay people, heard was, this is the smallest dose you can have. This is more progesterone, less estrogen. It's not going to hurt your heart, all that kind of stuff. What we did not know is that the truth was being prevented from coming out. And so that is a big deal. Now, copper IUDs. A lot of people have IUDs. I've done a little bit of research on this. The copper IUD poisons the sperm so that the sperm dies before it reaches the egg. Okay? So the copper, right, has long-term side effects and complications that go along with all the other birth control. Overall, doctors don't tend to take them seriously when women try to discuss it with them. Hormonal birth control has been linked to everything from strokes to breast cancer to glaucoma to multiple sclerosis, but many doctors who prescribe birth control know very little about these complications. So it is up to us to educate the younger women, and younger women are a lot smarter than I was at that time. I mean, I know I didn't think anything about it. The doctor said it was safe. I decided it was safe. I decided it was my contraception of choice. I did read the insert, and I did get off of it at 35. I wasn't on it 10 years before I decided to have children, so that might be why it didn't affect me in a negative way. However, there is the thromboembolic, I probably didn't say that right. It causes you to throw blood clots. So when you're hearing people are having a lung aneurysm or a brain aneurysm, if they've been on birth control pills, it could be a consequence of the birth control pill because the copper proteins cause clotting. In this day and age, we don't need anything that's causing clotting because clotting is already a big problem that we're seeing because of what's been going on in the past 2 years. It says there are tombs of studies about the clotting effects of hormonal contraceptives, but most of these studies are published in journals for pulmonologists and cardiologists, not gynecologists. It is the gynecologists that are prescribing the birth control pills, and they're not getting this information because medicine is so segmented. You've got a gynecologist for your female issues. You've got a pulmonologist for your lung. You've got a cardiologist for your heart. You've got an immunologist for your immune system, and it just goes on and on and on. We have people come into the clinic, and they've got 4 or 5 different specialists that don't talk to each other. So they're taking a myriad of prescriptions, and nothing is getting any better because no one is treating them as a whole. And this is what a holistic practitioner will do. This is what a natural practitioner will do, is we will look at you as a whole person and try to help you with that, okay? The doctors are so overscheduled, they don't have time to keep up with the latest science. Unfortunately, that means they often rely on the drug company sales reps to keep them informed, all right? So the researcher says when you have something that's been on the market as long as the pill, we tend to already have the assumption that it must be safe without really digging into it. We've been conditioned as consumers that any new reformulation of a product as new and improved is going to be better for us, and that's not necessarily the case, okay? It's not surprising that we assume new delivery methods or newer generation birth control must be safer. In actuality, the risks are higher for some complications like liver adenomas. What is an adenoma? That's a lesion. That could be a cancerous lesion, okay? Gallstones. How many people are having their gallbladders removed? Tons of people. We see it every day, all right? 3rd and 4th generations are having fertility problems. Bayer Pharmaceuticals has paid out more than $1.2 sorry, $1.02 billion to settle over 10,000 blood clot related lawsuits for Yaz or Yasmin. Those are birth control brands. Bayer paid out another 21 million to settle lawsuits for gallbladder related injuries, according or as a result of taking the birth control. So we don't want to do that. Okay, we just don't want to do that. We also have new devices like the Nuva Ring, and I know people that are on that. Okay, a study recently found that women using this device are twice as likely to develop blood clots as women using other forms of birth control, and 6 times more likely than women using no birth control at all. Then there's the Depo-Provera shot. Okay, the Depo-Provera shot, I think you take it once a year, maybe every 6 months, and it stops you from having a cycle, right? It suppresses the woman's immune system, leaves her more vulnerable to an HIV infection. Okay, it is a unique side effect that has not been linked to any other formula or any other device. And so what we're seeing is me as a consumer, right? If I know that if I take this hormone, I'm probably going to fill a blood clot, am I going to make that decision to take that formula? I don't know. Do I want to get pregnant? Do I want to have a blood clot? You gotta figure it out. But I want to know. And the thing is that because in the 1960s there was this whole political narrative of overpopulation, we've got to control the population, we're going to run out of food, we're going to run out of clean water. Same thing we have today with climate control, right? They're putting fear into people. We've got to limit the population because we're using up all of our good air and we're not going to have enough air to go around. That's why we have to interfere with the climate. So depending on what decade you're in and depending on what the political agenda is, that agenda is formulating the public health policy. And this is something up until recently I had not been aware of. I think we're all aware of it in the current situation where we are in 2022. But I would dare say nobody thought that having everybody on birth control pills for PCOS, heavy periods, acne, all these kind of things, perimenopause, nobody would have thought that that was driven by the political agenda. They most likely thought that your doctor was doing the best that he could for you. And so we as consumers need to do our research. And that's one thing I'm really glad that we do have the internet. I know the internet gets blamed for a lot of things and 5G and all that. And all that is right. However, we all have information at our fingertips. If we just do our due diligence to go and look at the studies, go past your first page of Google, don't just look at what Google wants you to look. Go down underneath and see things. I'm just telling you, the past 2 years, I've looked for information. I've looked on Google, found nothing. I've looked on DuckDuckGo or another browser, and I have found tons of stuff. So information is being suppressed. Information about your health is being suppressed. And so I'm not here to tell you what to do. I am a researcher. I want to know the facts. I think you're smart enough to make the right decision if you have all the facts. If you don't have all the facts, then you're not going to make maybe the right decision. I'll tell you, a few years ago, I scratched my cornea in the night. Don't ask me how I did it. I don't know. I don't know if I had mascara in my eye. Don't know. Long story short, took my liquid silver, did all the things that I do. Things weren't getting any better. My husband said, look, you only have one pair of eyes. Let's go to the doctor. Let's see what the doctor says. The doctor said, yes, you scratched your cornea. Yes, you have an infection. Here is a prescription. Go and get it filled. We went and got the prescription filled. I think it was $120 for a little bitty bottle of antibiotics. I read the patient insert. The patient insert said, do not take it for more than this many days and do not take it more than this many times per day. If you overtook the medicine, you are at risk of having a super fungal infection. What is a super fungal infection? A super fungal infection is an infection a mold, a mildew, a fungus, a yeast, a candida, some kind of fungus. A super infection is one that medication does not have any power over. So think of superbugs, think of MRSA, think of all those kind of things the drugs just are not powerful enough because the organisms have adapted. They said, don't take this longer than this many times, this many days, because you are at risk of getting a super infection. So I kind of had that. I have an infection. I did what I needed to do, went back to the doctor probably within the week. And the doctor said, yes, everything is resolving. What I want you to do is keep doing it. I want you to do it for another week. And I said, well, okay, the insert says, and I blah, blah, blah. I told him what the insert said. And he turned to me and he said, I am the doctor. I know more than the patient insert, and you need to do what I tell you to do. And I was offended. I'm going to tell you, I'm offended. My eyes belong to me. I do not want to risk a super fungal infection. So I did not do what the doctor said. Okay. I think I did take the drops on a very, very small dose, maybe once or twice a day, not the multiple times a day that he wanted me to, for a couple more days. And then I quit. I went back for my follow-up appointment and I was fine. I changed eye doctors after that because the eye doctor did not respect my opinion. The eye doctor did not respect my query. Now, did I know more than the doctor? No. I'm not saying I know more than the doctor. Did I read the patient insert? Yes, I read the patient insert. Why is the patient insert in there? Because the patient insert informs you as to what could happen if you take this drug. I hope if you are on medications, you're reading that patient insert so you see what the side effects are, what if there's any kind of black box warning, anything like that, and then you make the appropriate decision. I had a man in my office today. He was prescribed a medication. He took the medication. His ankles swelled up. I mean, they swelled up like a tree trunk. He got off the medication. He went to his doctor. He said, I'm having this side effect. Why didn't you tell me this could happen? Oh, well, they just put that stuff in there to protect them from a lawsuit. It doesn't really mean anything. And the client said, well, it means something because it happened to me and I don't want it. And I took myself off the medication. So what is your takeaway here? You're not being given 100% of the information. I think our laws are such that they have to put everything in the patient information that comes with your prescription. Please read it. Please heed it. Please seek out alternatives if this doesn't work for you. If you are on multiple medications, there are plenty of free websites. One is WebMD and one is Medscape.com. It's a free service. You have to sign in, but you don't have to have any credentials. You sign in, you plop all your prescriptions in there, and it will tell you if there are any adverse reactions. You need to know this. And because your pulmonologist, your cardiologist, your gynecologist, your immunologist, your endocrinologist, they're not all talking to each other. They could be prescribing different medications that are fighting each other. And so you are the consumer. It is your temple. You're responsible for making sure that your temple is operating the way that it needs to. And so use these resources and then go back to your doctor. Your doctor works for you. And say, I don't like these adverse reactions. I don't like this interaction. This is what, and it's not the pharmacist telling them. It's not me telling them. It is a website with all of the drug information in there that tells you these drugs are counterproductive to each other. You are your own best advocate. Just remember that. I love you. It is the weekend. Take care of yourself. Do a lot of self-care. And I will see you back next week. Share this video. Comment on this video. We'll get back to you. I appreciate the time that you afford me. And I will see you soon. Take care.